The most dangerous heart symptoms are the ones you don't feel. Heart disease often begins quietly, with signs so soft, so ordinary, that most seniors don't recognize them. A little breathlessness, unusual fatigue, poor sleep, even mild digestive discomfort. And that is what makes heart disease so deadly. In today's video, we'll uncover the silent signs of heart disease that seniors often ignore. We'll also look at what the latest medical research says, why these signs happen, and how conditions like coronary artery disease, heart failure, endothelial dysfunction, and sarcopenia quietly warn us long before a heart attack or hospitalization. By the end of this video, you'll know the early warning signs most seniors miss, how these signs connect to heart function, what research from top medical journals reveals, and when you should seek medical attention. Let's begin. Because your heart may be sending signals right now, and this video will help you understand them. Why heart disease is silent in seniors. Heart disease becomes harder to detect as we age. Research shows that older adults often do not feel the classic chest pain warning. According to a review published in the International Journal of Environmental Research and Public Health 2022, cardiovascular disease rises sharply with age. 75 to 78% of people aged 60 to 80 years have some form of heart disease, and the number goes above 85% in those over 80. But here is the problem. Aging causes natural changes in blood vessels, stiffness, reduced elasticity, and slower circulation. These changes hide the symptoms of heart disease until it becomes serious. Silent sign number 1. Unusual fatigue. Fatigue is easy to ignore. Many seniors think it's just aging. But according to 2 studies published in the European Journal of Cardiovascular Nursing, fatigue is one of the earliest and strongest predictors of heart failure. These studies followed heart failure patients for 12 weeks and found fatigue increased days before major worsening of heart function. Fatigue was strongly linked to low well-being and upcoming hospitalization. This means persistent tiredness, especially when it's new, may be the body's early alarm system. Silent sign number 2. Shortness of breath, even without activity. Breathlessness after walking is common, but breathlessness while resting, lying down, or doing nothing. This is not normal aging. The study by DECA 2025 also found that shortness of breath rises quietly before the heart gets weaker. Shortness of breath is a major silent sign of both heart failure and ischemic heart disease. Silent sign number 3. Swelling of feet and ankles. Swollen legs or feet seem harmless. Seniors usually blame too much salt, long sitting, old age, but swelling is actually a sign that the heart is not pumping blood effectively. According to the research by Stoyanov 2023, swelling is one of the most common overlooked symptoms of heart failure, especially in seniors with a history of hypertension, coronary artery disease, diabetes. If swelling becomes frequent, especially at night, it may indicate the heart is struggling. Silent sign number 4. Muscle weakness and slow walking. This is one of the least known silent signs. A study published in the Journal of Cachexia, Sarcopenia, and Muscle 2024 analyzed 420 older adults with chronic kidney disease. At first glance, it seems unrelated to heart disease, but the study discovered something important. Poor blood flow, peripheral arterial disease, weak blood vessel function, endothelial dysfunction were strongly linked to loss of muscle strength, slow walking, and sarcopenia. Why does this matter? because poor circulation is one of the earliest markers of heart disease, meaning if your legs feel weak or your walking speed slows down, your blood vessels, and possibly your heart, may already be affected. Silent sign number 5. Fear, restlessness, and anxiety-like episodes. Research published in Journal of King Saud University 2023 notes that many seniors with ischemic heart disease do not feel chest pain. Instead, they experience sudden fear, restlessness, increased heart rate. This is due to reduced oxygen supply to the heart, a silent form of angina that does not show classic symptoms. Doctors call this atypical presentation, most common in seniors, women, and diabetic patients. Why heart disease is hard to diagnose in seniors. According to the Journal of Clinical Medicine Review, managing heart disease in seniors is difficult because of multiple illnesses, multiple medications, changes in the way medicines work in the body, high risk of bleeding, high risk of ischemia. The study emphasizes that many seniors with coronary artery disease are underdiagnosed because their symptoms do not match the classic chest pain pattern. Nighttime shortness of breath. This is a classic sign of heart failure. The Chinese expert Consensus on Heart Failure explains, difficulty lying flat waking up, gasping for air, needing extra pillows at night, are all signs that the heart cannot handle blood flow during sleep. This symptom is often ignored for months. Slow recovery after simple activities. According to the Lancet Regional Health Europe review, older adults have higher risk of delayed recovery after walking, fast heart rate after mild activity, feeling exhausted after simple household tasks. This delayed recovery indicates that the cardiovascular system is struggling, loss of appetite. When the heart weakens, digestion slows because blood flow is prioritized to vital organs. Although this symptom is subtle, it is commonly seen in seniors with upcoming heart failure when to seek help. If you notice any of these silent signs, even if they appear mild, it is important to speak to a doctor. Silent signs are not meant to scare you. They are meant to guide you. Modern research shows that the body whispers long before it screams. Listening to these early signals can protect you from serious heart problems later. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult your doctor or healthcare provider before making any changes to your diet or treatment plan. The information shared here is collected from top medical research sources, but due to video time limitations, not all data can be included. For full research references, please check the video description for sources of articles and research papers.